Good afternoon. We're here at the High Desert Heart Institute, and I have the great pleasure of introducing to you one of our patients here at the High Desert Heart Institute, and one of the patients who was in our original study in 2009, Mr. Illya. Illya, where are you from? Where do you hail from?
Originally ex-Yugoslavia.
Yugoslavia.
Currently known as Croatia.
In North Croatia, okay. And how long have you lived up here in the High Desert?
I moved here in 1983.
1983. Okay, great. Okay. Now you were a patient here. We're sitting here in the background. In the background, we have with us today. We have we're in a room that houses two tables for EECP. And there's been yesterday and the day before yesterday, we've been doing some other videos with some patients who have undertaken EECP, which you're very familiar with because over the years you've had the opportunity to benefit from EECP, which to the public who may not know what EECP is, it's a non-invasive procedure, external enhanced counterpulsation, that aids patients such as yourself with history of having angina or chest pain, fatigue, shortness of breath. And so patients come in here, they lay on this table right here for an hour at a time, and they get hooked up to this sort of mass suit type process, and this machine is hooked up also to your heart rate, and it compresses and forces a better blood flow, okay, to the heart and also to other organs, and improves cardiac function. And you have done this about 3 or 4 times over the years, being our patient, you think, about 3 or 4 times?
If I remember correctly, I think I've done it about 4 times.
In January of 2009, approximately about a month, maybe a few weeks before the study started, you were admitted over to Desert Valley Hospital, one of our local hospitals here, where Dr. Siva does interventional cardiology. You were admitted over there for a procedure called an angiogram.
That's correct.
And you, at that point in time, had intervention for chest pain that you'd been having. And significant medical history. You have high blood pressure, which you've had for many years. Looking through your chart and looking at the medical records, your blood pressure, he had noted at the time, was 180 over 90, which is very high. The doctors had put you on medications for high blood pressure, which you've been on. They'd also extended out a medication called nitrates, long-acting nitrates. They put you on long-acting nitrates to try to also extend that out. And also, it also put you, that's when they first decided that EECP therapy would be very good for you. EECP actually produces nitric oxide, and so Dr. Siva, I wanted to see if you would be a candidate with being a patient on multiple blood pressure medications. You were in that category of what we call malignant hypertension. In the study, what we did was we did multiple testings on our patients. Over 7,000 points of measurements were done during this time period of 90 days with these patients. And you were one of those patients that we had a very, very good success with as far as reducing blood pressure on with this aspect of it there. And at the end of the study, I'm here to say at the end of the study that it was really important for you and by Dr. Siva to say arginine, okay, is something that would be beneficial for you. And then can you tell us in your own words how you've been doing in the 4 years or the 3.5 years, say, since the study was completed because of the time period? What's your life been like, okay, in that time period?
Well, you know, when I first started on that arginine 9, it took about perhaps 3 months, 3.5, 4 months, and gradually I start, feeling something is happening. Mm-hmm. And as I continue, I start gaining more energy, more, power to do, things that then I start engaging, extreme exercise, and the more I press it, the better I felt, and I mean, it just after about a year or so, I felt like I was born again. I mean, and prior to this RG9, and I had when I started walking, I was having difficulty making any step by, I was just, it was horrible,
I remember you in the study. You were I mean, your whole affect moved. You were very slow. It was very. You noticed you had a great improvement in your 6-minute walk test at the end of 90 days. Your fatigue factor, your shortness of breath factor,
it started declining. Yes,
yes, going through. And so, and then what we saw from you was a dramatic improvement. And at the same point in time, we saw the ability to where we were able to reduce dosages in your blood pressure medication also too, as the time's gone on. What is your daily routine as far as exercise routine now today? At age 72, if you don't mind me telling your age. At age 72, okay, what do you do on a daily exercise routine today right now, Illya?
You wanted me to show it to you?
Yeah, sure.
Okay, now.
Well, you don't have to do it all 220 times. But
Can I say something before I do
go
this?
right ahead.
Okay, when I get up in the morning, I have my own blood pressure monitor, and that's the worst time, when your blood pressure, you check it, and it checks out 120, 128, somewhere on there, around, 60, 65.
128 over 65.
And I have the house is pretty much airtight, and I leave temperature about 65 degrees. I do such intense exercising that I start sweating quite a bit, and I spend about an hour and a half every morning, 7 days a week, and an hour in the afternoon, evening, 7 days a week. And what my exercise consists of, it's jogging. I got a accommodating house. I figure ways to jog in the house, and then I do the squatting. You want me to show you the?
Sure.
Okay. What I do is I do 220 Ds.
220. Okay. All right. You don't have to do all 220. All right.
220 every day. Then I do 40 to 50 of these squatting.
Okay. Got it? Okay. Okay. All right, Illya.
I should do-
Okay, yeah, I know, but for time's sake purposes, we want to keep you. We want to keep going shorter down here. You don't have to do all 40 or 50, but okay, right, a couple of each will be fine for the camera here. We want to do this not marathon time right here. All right.
Then I lay on my back
Okay.
on the floor.
Yep.
I lock my feet underneath my coffee table. I put some weight so it doesn't lift. The table doesn't lift.
Okay.
And I go 120 of those.
So 120 sit-ups
Every day.
After that, 120 sit-ups after that. Okay.
Then I have 45 steps in the house.
Okay.
Living room, family room, through the kitchen. I put the carpet in.
Yep.
And I have heavy socks and
Yep.
without the shoes, and I do my jogging inside the house. So that way I have a temperature control. Winter time, cold. Summertime, hot, and the house is, temperature control.
And you do that 40, and you run and you jog that 45.
And that's about 4 miles every day, 7 days a week.
So because that 45 thing that you
45 steps
do, and you do that
times 220.
220 times, you do that 45 step time. So that's about a 4-mile jog also every day, 7 days a week also too.
And I believe, I'm certain of it, that RG9 gave me that energy to be able to accomplish what I just explained to the public.
Have a seat there, buddy, okay? Because you also did the pleasure of bringing your most recent lab work that you had done here last month, and you continue to shine. I'm giving you an A+ on all your lab work. Okay, Dr. Siva is going to be very, very happy. Your lipid panel, your total cholesterol is 147. You had history of hyperlipidemia or high cholesterol. Your total cholesterol is 147. Your HDL, which is your good healthy cholesterol, is 61, which really shows that your exercise regimen that you're doing today, as men age, our HDL naturally goes down. For a 72-year-old to have a HDL of 61 is absolutely fantastic.
Yeah.
Your triglycerides are 64, okay, and your LDL is 73. So for your lipid panel is really, it's an excellent lipid panel that you're doing there right now, buddy, okay? Going through. Your vitamin D level is where Dr. Siva wants it to be. You're looking at 83.2, okay? This has a good amount of vitamin D in here, okay, when you're taking vitamin D. This keeps your immune system strong, helps prevent osteoporosis, okay? Helps keep the blood pressure down, okay? Helps prevent colorectal and prostate cancer in men. So many aspects of this part process right here that also benefit of the arginine complex are also too. Your testosterone for a 72-year-old, okay, very good still there, young man. Your hemoglobin A1C, excellent, 5.4. All of your electrolytes, very, very good. Your CBC, you've got a very good hemoglobin and hematocrit. Your kidney function is absolutely fantastic. Sodium, potassium, all your numbers on your lab work, the doctors will be absolutely very, 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 very pleased with, okay, Illya.
May I say something?
Please.
I'm really convinced that this arginine is the way I'm putting it, I'm not any medical expert, but this actually enhances your internal mechanism. It allows you to do pretty much what I've been doing, for the last 3-4 years.
Yeah,
this is fantastic.
Yeah, it's for the entire body. It's just right there, and I think you're as one of the original study members, Illya, to how I see you today, what you're able to do today. For me, from the evidentiary standpoint, you are a classic example of some of the patients who have, with multiple medical problems, of high blood pressure, of coronary artery disease, who have had the angioplasties, had the interventions already. We're the patient that we don't want to have to go back to the cath lab. And you're a perfect example of how this is prevented, how this has kept you from going back to the cath lab and having another intervention. This is what the takeaway point for the audience today is that this here enables you to have a better quality of life, okay, along with other combination therapies that we're going through out there. So I want to wish you continued health and the best of luck in the future, and thank you for being with us today.
Thank you very much, and I do strongly recommend. This is it. That's my, it's the Bible right there.
Thanks, Illya.